Testing. Just continue to mingle. We got more people coming in. So we want as many people as can be. Dr. Duffy said he's not in a major hurry. So we got another one of the guys I used to work with that worked with Dr. Duffy, John. He's on his way. So we just want everybody to just, hey, feel free. Feel free, please do that. while we're giving a little more time, uh, Dr. Duffy was saying once we listen to what he has to say, questions and so forth, we understand some of you may have to leave. We got some brothers here from Fayette, Alabama. So we definitely he has to go back to a funeral at 2. So as soon as he get through speaking, questions start. He got enough people here to do the exams. John will be here. Of course, he'll be here. And of course, his assistant. There's John right there. I worked with him for about 20 years. So, but if you need it done and have to leave, just ease up, and we'll we got the place back there. We'll show you where to go. If you need this screening, we do have refreshments there, and we'll have more shortly. Okay? Okay, guys, the time has come. Dr. Duff is going to be coming shortly, but we're going to get Brother Chris, Deacon Chris, to come with a short invocation. And Pastor Gay will also welcome you to Beulah Missionary Baptist Church Family Life Center. At this time, Deacon Chris will come forth.
For our scripture, we're looking at Ecclesiastes 12, verses 13 and 14. Let us hear the conclusion of the whole matter. Fear God and keep his commandment. For this is the whole duty of man. But God shall bring forth every work into judgment, with every secret, whether it be good or whether it be evil. God versus God, people. Let us pray. Heavenly Father, we come down to pause right now and just say thank you. Thank you for another opportunity to come out and worship and receive information about the whole body. We pray that bless upon Dr. Duff, our speaker, as he gives information on today. We pray that you continue to bless us with good health and strength. In the mighty Jesus' name we pray. Amen.
Pastor Gay? Is he back in the back? In the kitchen?
Again, let me say good morning to all of you, and especially to Dr. Duffy, a good friend of ours, a good friend of this church, and a good friend of this community, one of the leading urologists throughout the South. And Dr. Duffy, we appreciate you and your staff, and he does this every year for us. Not a penny he charges us, nothing, just to do it out of the goodness of his heart. And we want to let you know how much we appreciate you doing that. Jerry, thank you. Jerry always sets this up. He's a survivor. And you go out there in the lobby, you'll see Jerry picture out there. He got his shoes out there, a picture of him, a hat out there. He wants y'all to know who he is. That's Jerry Taylor right there. So again, let me welcome all of y'all here this morning. Talked to a gentleman this morning, said he came all the way from Fayette, Alabama. So we got people driving all in this morning. This is really important, prostate cancer, and knowing how to do what our prostate really is about. And we're going to do a couple of things this morning. We'll have not only the exams, but we also have some question and answer sessions, some things you can find out that we did not know about our body. The Lord is concerned with the whole man, the whole man. This is the temple of God, and we want to get one of these temples. When you out of here, you out of here. And he wants us to take care of our temple. And so this is what we do. This is the kind of church we are. We believe in feeding the whole man. So again, thank all of you for coming out this morning. We're looking forward to having some exams done. I think one brother told me a while ago, what he said, you can bend over from right now, or you can lay cross there forever. So, and I thought that was a pretty good one. And so again, thank you again, Dr. Duffy, and Jerry, I'll turn it over to you all, Dr. Duffy.
Good morning. Thank you again for having us out again this year. It's always an honor to be asked to come back and do this talk every year, especially Pastor Gay, Jerry, and all of you. I forgot my clicker today, so I'm going to be over here by my computer to go through the slides. But for one, anytime you have a question, don't hesitate to stop me throughout the talk, because if you don't, you'll probably forget what you're going to ask. So, and no question is a dumb question. We're here to try to help you guys learn about your bodies, ask questions, and get some feedback of things that may be on your mind. We try to do this talk every year in September because this is Prostate Cancer Awareness Month. And we're back on schedule. Last year we had some scheduling conflicts, but again, thank you all for having us here. Oh, I did want to mention that two of my colleagues are here. John Chambers, who has been our nurse practitioner for over 10 years, and then Caitlin Hancock, who has been in urology as a nurse practitioner for a long time, but moved up here from Montgomery and Tupelo and has been working in our field for a long time too, and is very educated. And so they're here to answer questions, do exams, and so they're going to be a part of this as well. So first of all, you know, prostate cancer is one of those things that is a really common thing that men can go through. And one issue that we have is that a lot of time men are afraid to go and get evaluated and be screened for prostate cancer. So you can't be afraid to do that. So we're going to try to answer some questions today. First, what is prostate cancer? Am I at risk? How does one deal with prostate cancer? And then what do you need to be doing? So first of all, we're going to do a little bit of background. So your prostate is a gland, which means it produces some substances that are in semen. And it also is where the tubes from the testicles drain out the penis to where people can have kids. So it's essential to reproduction or having kids. It actually doesn't do a whole lot. The fluids that are made aren't essential, but the gland itself is essential. And so there are some risk factors for prostate cancer. Number one is age. So it's pretty rare to find men less than 50 that have prostate cancer. But men at 80, it's 80% of men can have prostate cancer. Now, that does not mean that those men will necessarily have issues or die from prostate cancer. It just means it's really common. Race is one of those things as well that has been shown to be a risk factor. So African American males are at 2 to 3 times increased risk of having prostate cancer. And one issue is that they actually have a higher risk of death from prostate cancer, not just a diagnosis of prostate cancer. It's very rare in Asian and Indian men, and part of that we think is likely related to diet. So one thing is that high-fat diet, BMI above 32, can be associated with the risk of developing prostate cancer as well, and also put you at increased risk of death from prostate cancer. So one issue that we have as physicians is that prostate cancer rarely presents with any kind of symptoms. So rarely do men notice any kind of changes in their urinary habits. They rarely have blood in the urine. They rarely have pain. Normally that's more associated with kind of advanced prostate cancer or prostate cancer that may not be able to be cured. The ways that we typically find prostate cancer are essentially through doing a history and physical, finding out if people are at increased risk based on family history, diet. And then we also do some blood work and an exam. So the blood work is what's called a PSA, and the exam is what's called a digital rectal exam. And that's why a lot of people don't like to come see us. So, PSA, this is a protein that circulates in the bloodstream and is only made by the prostate. And it's been shown that when that number is high or changes significantly, we normally say more than a point a year or a number above 4, that people can be shown to have a higher probability that they could possibly have prostate cancer. And PSA is a very controversial topic because it's not perfect. There's men that can have really bad prostate cancer and have a normal PSA. There's people that can have super high PSAs and they don't have prostate cancer. But it's the best, what we call screening test that we have, which means it's readily available, it's pretty easy to do, and it's not one of those super expensive tests. And so when PSA was developed in the kind of early to mid 80s, it took a few years for it to kind of catch on to be used routinely. But if you see from this graph, and basically all you're doing is looking at kind of in the early 90s, that's when a lot of primary care doctors started to do this blood test. You can see that there's been a pretty sharp decline in death from prostate cancer just because of the development of PSA. And so that goes hand in hand with what's called a digital rectal exam, which basically means a finger in the bottom. And what you can do is that you can feel about 60 to 70% of the prostate and feel if there are any kind of abnormal lumps, changes over the years, as well as you can also assess size to go along with not necessarily prostate cancer, but some issues that men can have just from an enlarged prostate. And so men should have PSA screenings normally even before 50, but we use about 50 to 75 as kind of the range. If you have a family history, that can be anywhere from 40 to 45 starting. So if any of those areas are abnormal, either the exam or the PSA, we normally recommend that people have an evaluation maybe outside of just the blood work and the exam. One thing that I don't have listed in my slides, I don't know how it didn't end up in there, but oftentimes these days we do what's called a prostate MRI, which is basically, it's an MRI that just focuses at your prostate, and it can enlighten us as to whether there are any spots on your prostate that look concerning for prostate cancer. And in those cases, we go on to a prostate biopsy, which is where you take a small ultrasound, put it into the bottom. This is normally done under a light anesthesia. And we take little snippets of tissue from kind of all over the prostate. And these days, we really focus at where the MRI can be abnormal. And it takes a few days to get a biopsy result back. And then that tells us whether people do or don't have prostate cancer. So if people do have prostate cancer, there are different grades of prostate cancer. And prostate cancer can act very, what we call indolent, meaning it's not aggressive at all. It's rarely going to do anything. It's rarely going to spread. Or it can sometimes be very high risk, meaning that it has a chance that it could spread quickly and move to other areas. And so when we get a pathology report or get the results from a biopsy, they give us what's called a Gleason score, which is basically a number from 6 to 10 that tells us how aggressive your prostate cancer is. If it's a very low-grade prostate cancer, sometimes you don't have to do anything at that time. If it's a very high-risk cancer, sometimes you have to do multiple things. And we'll kind of talk about that going forward. When we diagnose men with prostate cancer, sometimes you need some additional tests. Sometimes you need what's called a bone scan or a CT scan, or these days we do a lot more PET scans too, which are much more helpful. And so if somebody's diagnosed with prostate cancer, again, there's different ways to treat prostate cancer, which is a little different than some other cancers. Some people that have very low-risk prostate cancer, we put them on what's called active surveillance, meaning that they don't have active treatment at this time. We just watch it, and meaning that we check their PSA to make sure it doesn't fluctuate too much. We sometimes will repeat a biopsy in a year or two to make sure what was low grade hasn't gone to a higher grade. But some men do have more advanced cancer and need curative therapies. So there are a few different types of therapies. One is that some men need surgery to actually treat their prostate cancer. When we do that, we do those robotically, and the biggest reason why we do those robotically is that it's a better cancer operation, meaning there's lower likelihood that any cancer is left behind. At that time, we oftentimes can do the removal of lymph nodes, which is the first place that prostate cancer would spread from the prostate. And we get a pathology report back several days later, and that tells us better whether somebody may need even additional therapies based on whether there's any cancer that possibly was outside of the prostate or even into the lymph nodes. Secondarily, there are radiation treatments that people can do. Radiation can be done either through what's called external radiation or brachytherapy. External radiation is where men go normally every day for anywhere from 28 to 40 treatments. It takes about 15 or 20 minutes a day. When they do that, it kind of kills prostate cancer over a period of time. The advantage to radiation is that men can pretty much live their lives pretty similarly. They can still work. There's no recovery period necessarily. With surgery, people do have a recovery period, anywhere from 2 to 6 weeks, sometimes even up to several months to recover. So one advance that we've had over the last 25 to 30 years is that the advance of robotics in surgery in general, but especially in urology, and especially with prostate cancer. And it really has been more helpful for patients in general because it not only is a better cancer operation, it probably decreases the amount of pain that people have after surgery. It has decreased the length of stay that people are in the hospital, and it also has been helpful in a recovery standpoint that you kind of get back to doing things a little quicker. And so we're going to kind of talk about some myths that we hear a lot in our office about prostate cancer and prostate cancer treatment. So one is that prostate cancer doesn't kill men. Well, unfortunately it does. It's the second leading cause of cancer death in men, with over 30,000 deaths per year. And so that's the real reason why, for one, we're here today. Number two, we really stress to men how important it is to be screened for prostate cancer. So prostate cancer is only found in elderly men. Well, really about 15 to 20% are found in men that are even less than 50 to in their 50s. So it's a very common thing, unfortunately, even in younger men. we kind of talked about myth number 3. If you don't have symptoms, then you don't have prostate cancer. And then we kind of touched on this earlier, though, but because you have a high PSA, that you do have prostate cancer. That is not true. That means that we need to evaluate things better to see if indeed you really do have prostate cancer. And again, kind of the same thing with myth number 5. So a couple of more quick things. So if your PSA is low, you don't need a digital rectal exam. We get that a lot in our office. Why do I need to do an exam if my PSA hasn't changed, if my PSA is even normal? Because some prostate cancers actually don't even make PSA. And those are really rare, but sometimes those are so aggressive that they don't even make the protein. And so the only way that you sometimes find those is when you do a prostate exam. And that's why we really stress to men to at least have a yearly prostate exam. So probably myth number 8 is one that we hear a whole lot, that if you've had a vasectomy, you're at an increased risk of prostate cancer. That has been dispelled in multiple studies. There was a study a long time ago that said that might be true. It was not actually looking at this, and so we tell men that does not appear to be true at all. So don't worry if you've had a vasectomy or will have one. So one thing that myth number 9 is a really common thing that we hear. And with any treatment of prostate cancer, there are possible side effects. One thing that we see a lot of is men that can have changes in their urinary habits, whether those mean difficulty emptying, going more frequently. After surgery, we see a lot of men that can have leakage problems after surgery. Oftentimes, those are short-lived, meaning within a few months they get better. Sometimes they can be more long-term and even require procedures to help or fix that. Also, can men never have erections afterwards? Well, you're at a higher risk with radiation, surgery, any of these other treatments of prostate cancer that you do develop problems with erections or impotence. Sometimes those respond to medicines. Sometimes they respond spontaneously, meaning over a period of time they come back. At times they don't come back and need more further types of treatment, including vacuum pumps, injections, or even surgery and implants to fix those. And so those things can occur. They're not necessarily always going to occur. But those are the big side effects when you have treatment of prostate cancer. And then the last one is that we hear this a lot. Like, I was diagnosed with prostate cancer, especially in that time between when you're diagnosed and when you have treatment. Can you pass it on to others? And that is not true. You can't pass it on to your partner. You can't pee in a bathroom and pass it on to somebody. It is something that is in your body that you can't give to somebody else. And so one thing that I think is really important when you come out to these talks is not just talking about prostate cancer, but talking about your general health as a male or female in general, to make sure that you're doing the things that you should do to keep yourself healthy and safe. And so we're going to kind of talk about a few things. And so one of those things is, we talked about prostate cancer screening. One of the other most important things is getting regular exams with your primary care doctor, making sure you have regular lab studies to make sure kidney function, liver function, heart function, all of those things are good. Getting an x-ray of your lungs once a year. Colon cancer screenings. Nobody likes to have colonoscopies, but it's one of those things that has been shown to be very helpful in preventing deaths from these cancers. And so making sure that you're getting a colonoscopy at least every 10 years, sometimes with people with a family history, that's even every 3 to 5 years. You know, are you doing what you need to do from a nutrition standpoint? You know, are you eating the correct things? We talk about kind of low fat, fresh fruits and vegetables, trying to have a low sodium diet. You know, those things can be very helpful for your whole body, not just your prostate. And then lastly, you know, exercise is a really important thing. And a lot of men think that that means you need to go run 10 miles a day. That's not true. All you need is about 20 to 30 minutes, at least 3 or 4 times a week, you know, to get your heart rate up, make your body sweat, whether that's walking, whether that's getting on a treadmill, whether that's going to the gym and lifting weights. Anything you can do is going to be healthy for your heart and your whole body, including your mind. You know, one thing that I like to also talk about is kind of some general health issues that men can deal with. So one of those is what we call BPH. And BPH means basically enlarged prostate. And it is a really common thing for men, especially over the age of 50. And it oftentimes presents with some symptoms that men get concerned may be caused from prostate cancer. And rarely, like we talked about, does prostate cancer actually cause symptoms before you're diagnosed. What oftentimes men present to us with is what's called BPH. And basically, it is not cancerous, but men have a weakened stream. Sometimes they get up a lot at night. They feel like they don't empty. And that's a process that sometimes responds to medicines that you can take. Sometimes it responds to therapies that you can do, sometimes in the office. Sometimes it even requires, you know, even big surgeries. But there are multiple ways to deal with BPH, but it is a really common thing in a lot of men. Men can also have an overactive bladder. So overactive bladder is a little different than enlarged prostate, and it means that your bladder kind of starts to act on its own. Some men that presents as you go more frequently. Some men can't get to the bathroom in time or start going before they even get there. And this is very different from enlarged prostate in that they're treated very differently. It can respond to medicines, and sometimes it responds to medicines for enlarged prostate, and they sometimes can go on together. But it's one of those things that has different treatments, and probably 20 years ago, we rarely thought men had overactive bladder. It was one of those things that we thought occurred more in women. Well, as we've kind of shown, there's a whole lot of men that can have this problem too, and so we've started to treat more and more men for that problem. And then lastly, there is a concern that we have in men that if you see blood in your urine, what's called hematuria, that can present sometimes just when you go to your regular doctor and they check your urine under a microscope. But sometimes it can also just be seen when you pee. You look down in the toilet. If you think that it looks red, tea-colored, concerning, you need to let your primary care doctor or us know, because it doesn't always mean it's something bad, but blood in the urine can occur for several different reasons. It can be an infection. It could be a stone. It could also be a tumor from your kidneys all the way down to your bladder or even out the penis. And so those are rare that they occur, but it does need to be evaluated, and that's why you normally will give a urine once a year when you go to your primary care doctor. Sometimes we have to do evaluations for that, including CT scans to look. Sometimes we even have to take a little scope and look into the bladder to kind of evaluate that further. So, what can you do as a male? So, number one, and the thing that I stress the most, is go see your regular doctor at least once a year. Establishing a primary care doctor is really important because there's a whole lot of areas of your body that need to be evaluated. we as specialists in urology really focus just on what we deal with. We are not evaluating heart, we are not evaluating lungs, colon cancer, those kind of things. And so, really going to your primary care doctor is essential at least once a year. Included in that, your primary care doctor can do a PSA. More and more have stopped doing the digital rectal exam. We don't really know exactly why that is, but if you want to and they don't want to do that, you're more than welcome to anytime come to us. We're going to do exams today, especially if your primary care doctor doesn't do those yearly. And then, getting a urine study like we talked about, it can look for blood in the urine, it can look for infection. It can also be a good way to check how your kidneys are functioning and those kind of things. We talked about exercise, and one of the most essential things that I didn't talk about before is, smoking is one of the biggest risk factors for a lot of cancers, from lung cancer to kidney cancer to bladder cancer. And so, doing everything you can do to not smoke is really essential to your health as well. So again, I just want to thank all of y'all for taking your time this morning. I always am honored by Pastor Gay and Jerry as they call me to come and give this talk, and it's always been such an honor. And so, one thing that I think I like about this is the way a lot of men feel, and we want you to not feel this way. Okay, we want you to be comfortable. It's not a comfortable thing to always come see us. It's not a comfortable thing to have a prostate exam, but it's for your own good, and it's one of those necessary evils that really doesn't take a lot of time, takes just a few seconds, and it can really provide a lot of information for your own health. And so, at this time, I'm happy to answer questions. John and Caitlin are here if you have questions about yourself, any questions in general.
Dr. Duffy, what causes this gland to swell, and over a period of time, can the treatment stop this gland from swelling?
Great question. So part of it is just age is associated with it, and it has to do with kind of the changes in our hormone levels as men as we age, kind of can spur along causing your prostate to grow or swell. It actually can also be related to family history. Like a lot of people, if your dad had problems with enlarged prostate, you're at a little higher risk of having problems with enlarged prostate. And there actually are medicines that you can take that will shrink your prostate by about half, what are known as finasteride and Avodart or dutasteride. One thing that a lot of times in younger men, we try to avoid those medicines sometimes because they can have the side effect of causing erectile dysfunction or problems. And one thing that has been shown more recently is that if men develop erectile dysfunction from those medicines, even stopping the medicines may not recover that function. And so they're great medicines. They do a great job in that regard. But we also kind of don't just throw them at every man that has an enlarged prostate.
Good morning, doctor. Dr. Duffy is my doctor, and I had prostate cancer. I had the surgery, and I had the radiation. My question is, what role does testosterone play with prostate cancer?
Sure. So testosterone is kind of an interesting thing in that if men don't have testosterone, they will not have prostate cancer. Now, that's not actual life, Men need testosterone. That's what makes a man a man. But testosterone is kind of like fuel for prostate cancer. So sometimes treatments or assist in treatments are what are called anti-hormonal therapies, meaning that you cause a man's testosterone to go very low because it can shrink prostate cancer or even kind of keep it in check. And so testosterone is definitely part of prostate cancer, but it doesn't mean that if you've gone through treatment that you can never get testosterone back. So if a man has been cancer-free for a year or two and they've been shown that they have a low testosterone, you can give them testosterone. You know, it's not going to cause them to get more prostate cancer. Now, if prostate cancer is still lingering around somewhere in the body, it may cause that to grow faster. And so you just watch those men.
Hold it. Hold it. Hold it.
I have what is called an abnormal prostate, and my doctors told me that they wanted to remove my prostate because they were concerned about a spot that was behind there. Is that a normal practice?
So it depends on what they're referring to as abnormal. It would be pretty rare to remove a man's prostate without diagnosing him with prostate cancer or somebody having enlarged prostate symptoms. You can remove most of a man's prostate by surgery as well if they have enlarged prostate, but it would be pretty unusual to remove a man's prostate, especially like a prostate cancer treatment surgery, if you don't have prostate cancer. So I don't know the full details of yours, and so I'm not saying that whoever you're seeing is incorrect. Did you have a biopsy? Okay. And did they see prostate cancer? I gotcha. Yeah, you probably need to get the pathology report, and that's basically, it's a report, and it'll tell you kind of if you have prostate cancer, it'll give you that Gleason score like we talked about, and it'll let you know, and that might be why they're recommending what they're recommending. But you have access to all your medical records, and you can obtain those. Okay. Yeah.
Good morning, Doc. If someone in your family had prostate cancer, what should we, if it's part of your family history, what should we be looking for as far as prevention and, trying to monitor what we should be doing?
Sure. So if you have, especially a first-degree family member, meaning your dad or your brother has had prostate cancer, it can put you at a much elevated risk that you could have prostate cancer. Doesn't mean you do or will. It just means you're at an elevated risk that you could have it. So in people that have a strong family history, we normally recommend that they get screened initially, starting normally about 40. And if that's normal, normally every 2 years after that till about 45. And then from 45 to 75, they should have yearly screenings with a PSA and a digital rectal exam. And so you don't really have to change, like, you won't have any different symptoms, than anybody else. It just means that you're at a higher risk and just need to be screened more starting a little earlier and probably at least once a year.
Here I am back here. Good morning.
Good morning.
I just wanted to ask one question. They advertise the, a beta prostate stuff that you can buy at Walmart.
Sure.
Is that stuff worth your money?
So super beta prostate and prostate health and all those, I am not a huge fan of them. And it's not because I don't think they work for some men, because there are some components or things in those pills that can be beneficial to men as a whole, from vitamins, Some of them have what's called saw palmetto, which is an over-the-counter medicine that has been shown to help some men with enlarged prostate. The problem I have with a lot of those medicines is they're just really expensive. And I think that the benefit of paying $40 or $50 a month for some of those medicines isn't quite as beneficial as the cost to me. I think that if you want to take something, I would just take a regular men's multivitamin and saw palmetto, and it'll probably be a quarter of the cost and probably do as much as those medicines in general do. Jerry?
Yes, Doc, I'm a 22-year Navy veteran, and I do have a history of, through my grandfather and my father, of prostate. I have an enlarged prostate, and I'm taking medication for it, and I have my annual exams every year. Does that have a relationship? Does prostate have anything to do with having erectile problems?
I don't want to say no, but it's pretty rare that prostate enlargement or prostate cancer itself causes a lot of problems with erections. Oftentimes, more issues with erections are caused by either other medical issues like high blood pressure, diabetes, some of the treatments like we talked about for enlarged prostate. One of the side effects can be sometimes erectile dysfunction, but normally just because you have enlarged prostate or even prostate cancer, that normally isn't the cause of erectile dysfunction. Does that make sense?
Stay on this subject because I know a lot of men go through erectile function. You mentioned something about diabetes and high blood pressure. And I know that attribute to some of that too, but the history, my grandfather had prostate cancer, and my father had prostate cancer. Now I have three other brothers. None of us have had prostate cancer. But like I said, I have an enlarged prostate, and I'm pretty sure a lot of men in here have enlarged prostate. And the medicine seem to be working. But sometimes I have to go to the bathroom real bad, almost finna pee on myself.
Right.
And then there's sometimes I feel like I have to go, but when I go, I pee, but it's not a lot. So what is that? What problem is that? Do I need to talk to my doctor about that?
Yeah, sometimes you can't just figure that out by talking to somebody. But it sounds like the symptoms that you're describing are more like the overactive bladder kind of symptoms. And like I said, a ton of men have enlarged prostate. But a lot of men can also have overactive bladder. And that is treated oftentimes with different medicines or different therapies than an enlarged prostate. And so sometimes you need additional medicines or additional therapies to kind of help with the urgency, as we describe it, where it's like you feel like you got to go, you get there, and there's not a whole lot there. Or that urgency that, oh my gosh, if I don't run right now, I'm going to start peeing on myself. And so those are more overactive bladder symptoms typically than enlarged prostate symptoms.
Good morning. No, it's not on. Okay. My symptom, somewhat like the last brother was saying. I'm 78 years old, so some of it I think is aging. But like in the morning when I wake up early because I had to go. But if I don't go right away, I'll start leaking. Okay. So, and I've heard this PSA, and I have those tests, and they don't tell me anything. So I'm wondering, do I need to just, I don't know what I need to do, but I know I can't hold it like I used to. When I gotta go, I better be trying to find somewhere. Don't, I'll start leaking. And like when I mentioned to my primary care, they said, well, if you're not, you know, uncontrollable, don't need no pad or nothing like that. It's just that if I don't go, you know, when I have to, I can't wait too long. So I'm just wondering, do I need to tell somebody I got get checked for prostate cancer? And I have all these lab tests, and so no one tell me that everything is, it may be elevated, but it's nothing out of whack. So, you know, and you know, weak streams and stuff like that. But you know, I do get up, not all through the night, but I'm just kind of wondering. That's why I'm down here to see, do I need to go further and stuff. Of course, you know, like I said, me and the brother that got a lot of similar symptoms. So I'm just wondering, what stage am I in? Seems like I might have a little overactive bladder and stuff, and what I've learned here today.
Yeah, I think that you definitely at least have partly overactive bladder. Now, whether you also have enlarged prostate, that's possible too. Like I said, it sounds like this gentleman probably has both. You know, he's being treated for enlarged prostate, but it also sounds like he probably has a little bit of overactive bladder too. And what we tell men when it comes to a lot of these symptoms is, I don't assess whether you wear pads or anything like that as to whether you should be treated. I look at your quality of life, and I tell men, I say, look, if this bothers you enough that you want to try some type of treatment, then we'll try it, okay? Some men get up 3 or 4 times a night and they don't care. Some men get up 1 time a night and they think it's the worst thing ever. And so we will treat as long as you, and we would evaluate you. So there's a few things that you want to do in all men that you're concerned may have overactive bladder. The first thing is make sure that they're actually emptying their bladder, okay? Because some men can have a silent bladder that just kind of overflows, and their bladder never fully empties. And so they get the sensation to pee, but their bladder isn't strong enough to empty their bladder out. So they have to go frequently. They sometimes start leaking when they try to go. And so that's the first thing that we want to make sure of. And that's a simple test that we do in our office, where we basically scan your bladder to see how much is left in there after you have gone to the restroom. And so it's one of those things that you can't always just know exactly what's going to be the perfect treatment for you without doing a little bit of a kind of background, checking your urine. It sounds like your PSAs from what you've said are okay, and so I would think that it's probably not from prostate cancer. Now, can I guarantee that? No, but I think that it would be pretty unusual, because prostate cancer normally doesn't present with those kind of symptoms. It's more either enlarged prostate or overactive bladder or both.
Good morning, Dr. Duffy, and the Beulah Knights. I'm glad to be here, because this is a good learning experience for me to know about my body more, and what we can do to be, keep ourselves safe. The question I have that, what do you think, how we can encourage the young people, like our nephews and our son, to take life more serious and start concentrating on their body better, instead of waiting later or go to the doctor and have a bad report? Because as we was growing up, nobody really encouraged us about going to the doctor and stuff like that. And we have sons and nephews now, and they think it's just for an elder person or middle-aged person to get themselves checked out like they're supposed to.
That's a really good question.
Good question.
And it's something that I think we deal with as nationally, not just locally. But one thing that I think is important is that as we have gone on as a society, a lot of these things have become less taboo. So I'm sure my dad never talked to me about his health, ever, but more and more men talk about their health. Y'all are here. I mean, I bet if we did this 20 years ago, we probably wouldn't have had the turnout that we have. And so one thing is that people are becoming more educated and really less scared. And so what you're doing is fantastic. And what you can do is just encourage them. Say, look, somebody that's 25 or 30 may not need to go to a doctor every year, okay? Even though it's recommended, okay? But every few years to go get checked out, especially at that age, is really important. And then, as men mature, hopefully they will understand the importance of going. But sometimes what you don't know, you don't know. And so what you as family members can just simply say, hey, have you gone to your doctor recently? Or have you been screened for prostate cancer or colon cancer, to your son or nephews or even your brothers, even if they haven't been to a doctor in a long time, it is one of those things that I think the more that you encourage them, the more that but you don't, I try to stress to people, you don't want it to be a chore for people, you want to try to say, look, and there are, all over the state, there are prostate cancer screenings that are done almost in every county. And so, if that's all they do, like, that's better than nothing, and you can go, and I've had men that have come to me and or from Butler and had a prostate cancer screening there and come to me and their prostate number was high. And they didn't do the prostate exam. They didn't want to do that, but they did something, And so even little things I encourage people, like just going to a prostate cancer screening. If we need to do this some evening on a Wednesday, we could do that. If it would encourage younger people to come or people that work on Saturday mornings. Like, I don't mind changing what we do sometimes or doing another one sometime, because it may be impossible for some people that want to come to this to come on Saturday mornings, and so we can also do what we can to try to help as well.
Morning, Doctor. I'd like to say thank you to you and your staff and the Beulah Baptist staff for hosting this. I don't have a question. I'd just like to respond a minute to Sammy's question. I think older people say when we know better, we do better. And in the past, black males have had a problem with going to the doctor and having having a finger stuck up my behind. But then again, like I said, when we know better, we do better. I'm one of those people. I would talk to Mr. Steele a lot of time with conversation. I had a high PSA level. Mine was at 20. And he said, man, you need to check yourself, which I was. A couple of doctors told me they thought I had prostate cancer, but I went to Dr. Winfield, who's my urologist, and he did the check. He said, nothing wrong. So I went back, another doctor said, man, I think he got prostate cancer. So I did a biopsy, nothing wrong. Dr. Winfield did put me on finasteride, and my PSA level went from up about 20 back down to about 3. So now I know that finasteride will probably be my medication for life. I don't mind that because sometimes you have to make choices. I think like the gentleman said earlier, you can lay flat or I can stand up straight. I prefer standing straight. And I think, just most men in here do as well because we're here to be educated on it. And then, like I said, we're going to have to go out in the community and educate others. So that's what this is all about. And appreciate you.
Definitely, and I think that
Great.
that shows you that you can have like 20 is a really high PSA, okay? Anything above 10 is considered pretty elevated, and especially when you get to 20. But just because that number's high does not mean you do have prostate cancer. And so, you know, you do have to be evaluated normally, especially when it's that high, but it doesn't mean you're going to have, or that you're going to have prostate cancer.
Doctor, I can relate to what he's just said. During my time, 14 years ago, mine started at age 45, and it was amazing how it came upon me. I worked at the hospital and all that kind of stuff, but you know, it was like I had severe chills at age 45. Severe chills, no fever, but he told me it was inflammation of the prostate. Of course, moved on a little bit further. At age 55, I had the robotic surgery. So I have been, actually, ever since I've had mine done, it's been zero detectable. And one more thing, I give honor to the doctors and to God, because, you know, I did not have to take chemotherapy or radiation. Neither of that. Now, to me, you know, it was just God. But guys, listen to your body. Listen to your body. And that was a good question you asked about getting our young people involved. I don't know what it's going to take, but we need to get them involved. Because it don't have to be, like you said, 70, 80 years old. I'm 70 now, but God still got me. I'm just grateful to everything that God has done. I'm grateful to all of you guys for being here to get the information.
Any other questions?
I haven't dropped my drawers like you say on that picture in a long time.
It's all right.
So obviously, I probably need that test. Like I said, now I've heard them say about the PSA test, so they never told me that I needed to do that. So, but I go to primary care regularly, and I'm a veteran, so I see my doctor there every 6 months. So if I haven't had the finger in my rectum, I need that. That's what they call the prostate screening.
That's correct. You know, and
So that's what I need.
you're in luck. You can do it today if you want.
Okay.
Actually, guys, that's what this is about. That is what this is about.
But no, you know, it's one of those things that, yes, I think that it is important to have. You know, that's probably more controversial. I tell men probably once a year in men that have an elevated PSA, and if people are really averse to it, meaning against it, I tell them every 3 years, if your PSA is normal, I think you can probably do that. But I try to do it once a year, but some men just really don't want it. And so,
Yeah, Doc, I have another question. You mentioned something earlier about the overactive bladder. You said something about you can do something, look at it. Do y'all do that test, or how do I get that done? Do my doctor have to make contact you guys for me to have an appointment?
yeah, you know, that's one of those tests that we do have to do in the office. I don't think that a lot of probably primary care doctors have that equipment to do. And yes, you could make an appointment to see any of us in the office, and it's a quick test, and you know, we can kind of talk to you about some of your symptoms too and see if there's anything else that you'd like to do.
Dr. Duff is through, what we can start doing. Somebody might want to say something, the pastor at this time or whatever, but we can start. If you need to be screened, we can get lined up. We'll show you where to go. His people are here to us to do what needs to be done for you.
Jerry, can I say one more thing?
Yes, sir.
So as we're doing these exams, and even before and after, if you have a question that you didn't want the whole group to hear, you're more than welcome to come up to any of us and ask that. We're happy to do prostate cancer exams. If anybody doesn't think they've had a PSA or wants a PSA, unfortunately, we can't do the blood work here, but we do have the availability that we oftentimes can get you to come to the office and get that done, and most of the time we can get that paid for if you don't have insurance or those kind of things. We oftentimes can get that done for you.
One last comment.
I just want to thank the Pastor Reverend Gay and Dr. Duffrey and God for modern medicine to think enough to come out here. Your health is more important thing. A lot of time we need encouragement to come out and see better ourselves. So we thank God for those two and hope God will continue to bless them in their work. Thank you.
Thank you, sir.
Thank you.
Thank all of y'all for coming out this morning, Dr. Duffy. We're getting ready to, to do the physical exams right now. We're going to reward you. We're going to have some biscuits for y'all. But you bending over, we're going to have some biscuits. You can get your biscuit. They're going to bring them out this morning. You can get them while you're waiting in line, or when you get through with your exam, you can circle back around and get your biscuit. We want you to. We do have refreshments and some juice and different things. And again, what a great group to come out on a Saturday morning to learn more about our body. And again, Dr. Duffy, thank you so much, you and your whole staff, and Jerry, as always, again, for making this possible. This is being shown on our Facebook page, our Beulah Baptist Facebook page, and it'll be remain up there for a while because we got people really all over the country watching us this morning. And again, so again, I just want to thank you so much for this.
Thank you, Pastor Gay. Okay, at your discretion about the exams, Dr. Duffy.
Yeah.
In line right outside the door here. We'll show you, if this is your first time, we'll show you where to go. Don't feel free to do it. This is the time. Any doubt?
For those that's waiting, you can eat your food, and while you're waiting in line, just however you want to do it. Tell them to bring the food on out now.